Hi everybody. As I promised, I will go over your vocabulary words to make sure that you know exactly what it is that I'm asking of you during your quiz. So we're going to get started with the list that starts with graphic. Now, what I did on this particular list is I only explained all of the words that you may have had difficulty with. There might be more than one definition, and I'm just clarifying as to which one you need. Regarding the other words, I will go over those and give you a shorter definition because I'm pretty sure some of you wrote a lot, and that's not necessary. I just want you to make sure that you do have the correct term. So you probably won't see me talking to you, but you will hear me because I'm going to expand the screen so you can see the PowerPoint. So let's get started. With the weekly vocabulary, starting with graphic, the word or the definition that you should have is relating to a pictorial representation, but it can also mean depicted in a realistic or vivid manner. And if you remember while you're watching TV, there may be a disclaimer at the beginning of a TV show saying that some images may be graphic and small children shouldn't watch, or viewer discretion advised due to graphic content. That is what the definition should mean. As you can see, this individual is burnt and he is deceased. So this is rather a graphic picture, if you will. All right, your next term is comatose. That is in the state of being in a coma. Rigor mortis is stiffness after death. Post-mortem is after death. Moribund is the process of dying. Denial, acceptance, bargaining, anger, grieving. You should put a star by those 5 terms or put arrows denoting that those are the 5 stages of grief. I think we talked about this a while ago. I'm sorry, not the stages of grief, the stages of dying. And so these are the stages that people go through when they receive bad news or somebody has passed away, and they don't necessarily have to occur in this order. Now, I'm not going to go over these terms with you because we've done it before, and the definition as is. Now, jaundice. Jaundice is also known as icterus. It is yellow discoloration of the skin, whites of the eyes. As you can see, the newborn on the left is fairly yellow, and on the right, he is a little bit more red and tanned. What happens is, in infants, mommy's blood and baby's blood, they mix after they cross the placenta during the birth process. Baby's blood may not match mommy's blood. In the case of my son, Cameron, I'm O positive, he's O negative. Mommy's blood and baby's blood didn't mix, and so he was slightly jaundiced. And what happens is, or how that they have to get rid of what's called bilirubin. Bilirubin is the excess that occurs, the breakdown of a red blood cell, and that's what causes the yellow content of the skin. How you get rid of it? In infants, they have to poo and pee in order to release the bilirubin and get rid of it. Or if the condition is more severe, such as this infant that you're seeing, they have to do what's called phototherapy, where they put the baby under in the incubator with the little sunglasses, and the UV light has to break down the bilirubin in order for the baby to be to excrete it through urine or defecation. And with the therapy, like I said, it will break down the bilirubin in the blood cell, thus getting rid of it out of the skin and going back to a normal pigment. Also, you can have jaundice because of liver disease, where it says due to an increase in bile pigments in the blood, often symptomatic of certain diseases such as hepatitis. If you have a liver disease and your red blood cells are not being processed correctly, well, guess what? The liver is going to be your blood cells will be affected, and then you will therefore be jaundiced. If you guys look at the side of the room, I have a liver up at the top, and that's somebody that is an alcoholic, and their liver is enlarged, and more than likely they also have jaundice. Next, mediastinum. The mediastinum is a medium or septum or partition between two parts of an organ or paired cavities of the body. The most common area that you will find a mediastinum is between the lungs, the right and left lung. There is a septum. Sorry. Right here, there's a partition that divides the two. They are paired organs, but they're separated by a partition. So I'll give you time to write that down. The next two times, temperature, we've gone over in vitals. Neoplasm is a form of cancer, or it is a tumor. Receive, definition as is, pharynx. The pharynx is the tube or cavity with its surrounding membranes and muscles that connects the mouth and the nasal passages with the esophagus. It is a common passageway for solid foods, liquids, and air. And there are three regions of the pharynx: the nasopharynx, oropharynx, and laryngopharynx. And pharynx is also known as the throat. Alright, the peritoneum is difficult to show you on the slide, so I did give you a more accurate definition. There's a YouTube clip that I don't have on this slide, so I will go back and find it so you can see it. The serous membrane lining of the abdominal cavity and its investing viscera. What that means is there is a liquid-like membrane that lines the stomach, and it also protects other organs in its vicinity. So I will find your YouTube clip. I probably have to put that at the end, only because my link didn't save. So I'll make sure that you guys get to see that. I'll give you a few minutes to look. Oh, I'm sorry, write that down. Pathogen, germ, rapport, It's a relationship between two individuals, a good relationship. Senescent is the act of aging, sterilization, to clean, transmission. I know the definition probably says something along the lines to transmit. Transmission is to pass along. Aneurysm. So with an aneurysm, it is a swollen vessel because there is damage to the inside of the vessel. If this should rupture, you die. An aneurysm can occur anywhere in the body. This one is in the abdominal aorta, and this one is probably the most common. People mistake it for back pain. This is why I put an x-ray here to show you that the plaque that has built up in this artery, the plaque that has built up in the artery, which has blocked it, causes the swelling. And again, this is why people mistake it as back pain, but this is actually this swollen artery that you see here. Again, if it ruptures or bursts, that's death. There's no coming back from that. You bled internally from the inside, and it's very quick. Here's another type of aneurysm. This is a brain aneurysm, and on this particular picture you can see there are several bulges or swellings located in different arteries. Now with a brain aneurysm, because the vessels are so delicate, people that experience brain aneurysms usually have a higher chance of survival because they have symptoms that say that something is wrong. They may lose their eyesight. They have a headache that is the worst they've ever had in their life. They're dizzy. They are confused. And with those symptoms, if you have all of it, sometimes they even vomit. Depending on what a person's health history is, they can be immediately rushed to surgery, have the aneurysm taken care of. They put a stent in order to open up that vessel, and all is well. But again, if it's not and it bursts, this can also lead to death. Right here, let's see if my mouse will act right. This is an aneurysm in the brain. So as you can see, this is a pretty big bulge, and if it were not taken care of, this individual may not live. And the last word is attitude. We all know what that is. I'm not giving you that definition. And that should be the end of this one. Alright. So, if you should have any questions that you don't understand or you need clarification, you can always email me and I will try my best to get back to you in a timely fashion. Let me move on to the next one. And let me pull up my words so I can follow along with you guys. Alright. So, regurgitate is the act of vomiting. That is one definition that you may have heard of. And the second is backflow of blood within the heart. What happens in the heart is if you have a faulty valve, the blood does not go all the way through the heart. So it goes backwards, almost as if the heart is throwing up blood. That's probably the easiest way to understand it. But if you have a faulty valve, a valve that doesn't work correctly, the blood will essentially go back into the valve that it came out of. Tachypnea, you should know what that term is because we discussed this in vitals, but it's a respiratory rate above 25 respirations per minute. Alveoli or alveoli. This is the location of which gas exchange occurs in the lungs. It looks like grapes. Emphysema. Emphysema is a condition in which the air sacs of the lungs are damaged and enlarged, causing breathlessness. Emphysema is typical of someone that smokes, heavily smokes. Axilla is armpit. It is also known as axillary region. Axillary. Axillary. So axilla, axillary are the same thing and mean armpits. Halitosis is extremely bad breath. Halitosis generally happens when someone may have a digestive issue, and it can also occur when someone has a rotting tooth. This smell just does not go away with mints, brushing your teeth, chewing gum. It is very foul. Alright, so to dilate is to make or become wider or more open. It can occur in the eye as well as the cervix in the female when giving birth. And please do not get cervix confused with cervical in the spine, which is in the neck. They are two different areas. The cervix, again, is in a female, near the uterus. Cervical is in the spine. Yes, there is cervical cancer, but be mindful in the context and the location of the body that is being used. because the neck cannot become wider or more open. Remember that. Alright, so the diagnostic tool to view the back of the eye is when you go to the doctor and they dilate your eyes, and the reason why is they want to see what's behind there. There are different diseases that an eye doctor can identify by doing so. And as you can see, the eye to the right is dilated. There's also a condition called Argyll-Robertson pupil, and that's when someone's eyes are dilated consistently, and it is related to having tertiary or the third stages of syphilis. Okay. Let me see if my video is going. There we go. So here's my video for the dilated eye. So that should, no. Okay. What's going on? Hold on, y'all. I'm difficulties. There we go. Whoa. There we go. Okay. And then here is the cervix. Cervical effacement and dilation during labor. You have the uterus, the cervix, and the vagina. And this is just giving you a depiction of what occurs during labor. You have to be 10 centimeters dilated in order to be able to push. And I know all too well about 10 centimeters. Alright, perineal is below the pelvic diaphragm and between the legs. Yes, this picture looks a little graphic, but it is what it is. You have the vagina or the vaginal opening, the urethra opening, and the clitoris here. Now what happens is this region from the bottom of the vagina to the anus, that is considered the perineal region. During childbirth, you can either be cut, which is called an episiotomy, to help open this up, or you will tear because the baby is trying to come through here. Dentures, false teeth. Petechiae. There it is. Okay, petechiae. This occurs when someone is going through physical therapy and they're having soft tissue manipulation performed. And what happens, it's not a massage. A massage is pleasurable. It feels good. Soft tissue manipulation is to break up scar tissue. It is to assist mobilization in whatever limb or area that the patient has an injury. It's small red or purple spots caused by bleeding into the skin. Essentially, the friction or the rubbing that is performed over the muscle area, it's breaking blood vessels. So these small dots that you see across this young lady's shoulder and back, those are broken blood vessels. When it gets to a point in the therapy that an individual starts to exhibit petechiae, you must stop immediately because you will further damage the blood vessels, creating more scarring and bruising. Diathermy is a high-frequency electric current which is delivered via shortwave, microwave, or ultrasound to generate deep heat in body tissues. This is an older type of therapy used. It's commonly used on chest congestion. So people that have sinus issues and not really into taking medication, there are different types of pads and devices that you can put across the chest area in order to help break up the tissue. The phlegm or the mucus. You can also use it for sprains, strains, muscle spasms, things of that nature, but it is commonly used for chest congestion. Okay. On here there was some typos, so the area or the parts that you see a line through, just make sure you take that out. Actually, no, that's not right. Write everything down that you see. A sitz bath is a warm, shallow bath that cleanses the perineum, which is the area that we looked at prior to this slide. It is a space between the rectum and the vulva or scrotum, so a male can have an issue with this area too. A sitz bath can be used for everyday personal hygiene. It can also provide relief from pain or itching in the genital area. It can also be used for treatment of hemorrhoids. It can also be used for treatment after childbirth for a perineal tear. And you soak with water and peroxide. You do sit for 15 to 20 minutes. As you can see to the right, there's a small bowl that you put on top of a toilet to sit on. You put your water, peroxide, in the bowl to sit and soak. And where it says piles, piles are referred to as hemorrhoids. So you can use this for everyday personal hygiene, treatment of hemorrhoids, treatment of pain or itching in the genital area. That could be from an STD, that could be from jock itch, and it can also be used to treat after a perineal tear from pregnancy. Emesis means to vomit. Peripheral, on the outside or outer region, what you commonly hear is your peripheral vision, meaning that you look straight forward and you can see to the side. You hear it. For those of you who are a marching band, you have to use your peripheral vision. When you're driving, you have to use your peripheral vision for someone coming over into your lane. But that also means on the outside or outer region. Those are just examples.